Hi guys, welcome back to my channel. Today we'll be looking at oral medication administration. So oral medication administration is one of the skills that you will be assessed on the day of your OSCE. So today I want to share with you the key elements that you need to address in order to demonstrate your competence in medication administration via the oral route. As you can see on the chart here, on the screen, on your left hand side is the performance elements or the expected performance, and on the right hand side is the performance criteria or the critical criteria that you need to make sure that you address. So the first expected performance is the patient-nurse therapeutic relationship, and in this criteria, what are you expected to demonstrate and address? The first one is address the patient by name, introduce yourself, establish a therapeutic relationship, and obtain the patient's consent for the procedure, whatever you're going to do, even if it's just simple oral medication administration. The next critical aspect is provide privacy to patient and maintain patient's dignity at all times. Always make sure to demonstrate acceptance of the patient's individual rights and dignities, regardless of their race, culture, gender, mental or physical states. It is always also very important to maintain an effective process of care when you are confronted with differing values and beliefs. The patient might have a differing, values and belief system from you, but that is not what is important here. The patient is important here, and the care that you provide is important here. So make sure that you always remember to demonstrate that. And when you finish a procedure, you terminate your procedure or whatever that you're doing to the patient appropriately by letting the patient know that it's done and reassuring them if needed. So those are the performance criteria or critical aspects that you are expected to demonstrate in order to establish a therapeutic patient-nurse relationship. The next point is communication. And the critical elements that you need to address to ensure that you have effective communication is you review the medication chart, as you can see on the screen. Just go through that. And if your patient happens to have some sort of communication deficit, hearing problems or hearing issues or can't see properly, so make sure that those aids, whether they need a hearing aid or whether they need their glasses, make sure they have those appropriately when communicating with your patients as well. And always make sure to document the results. If there's an adverse event or any other findings, then you make sure that you document those in your documentation, in your progress notes. Now, coming to the next performance element is planning and organization and safe practice. So the elements in planning and organization are pretty standard. And in safe practice, the key points to keep in mind are your 5 rights, or rather your 6 right now, with the right documentations being added, and your 3 checks. Now, what are the 3 checks? The first check is when the medications are pulled or retrieved from the medication drawer. The second check takes place when you're preparing the medication for administration. And the last and final check takes place at the patient's bedside just before you give the medication to the patient. This is also an excellent opportunity for you to educate the patient about the medications that they're taking. The next section is critical thinking. So you always clarify with your nursing team leader where appropriate and seek direction. Take appropriate action if the patient's consent is not given. Or if the medication order is not valid or legible, then you would use your critical thinking and you would inform the doctor that prescribed the medication to rechart it and let them know that their prescription is invalid. So as you can see on the list here, these are some of the ways in which you can demonstrate your critical thinking or use your critical thinking when giving medication. The next stage is the implementation when you give medication. So the first thing, as in any procedure, you wash your hand, check the medication order. I won't go through that. All the procedures for medication administration. And as we discussed previously, there are 3 checks that happens, and when it happens and what you check are listed here. So when you do the first check is when you pull the medication out of the medication cupboard or drawer or whatever. You check the medication label to confirm the generic name of the medication. You check the strength of the stock of the medication that you have, stock strength, expiry date, and any warnings. Okay. So after you do your check, you calculate the required amount of medication you prepare, discard whatever is excess if applicable, dispense the correct amount of medication using a non-touch technique, and then you do the check again. You check the medication label, you confirm the generic name of the medication, the stock strength. So you basically repeat the checking process at the 3 points check which we've discussed before. So those are the critical performance elements that you need to keep in mind and you make sure to address when you are being assessed in your OSCE for oral medication administration. I'm sure you're already aware of the fact that your skills in the OSCE assessment are going to be assessed against a new graduate nurse here in Australia to check that if they're on par with a new graduate nurse's skills and clinical knowledge. So the points that I have just listed you here and explain are some of the competencies that we use to assess competency for oral medication administrations. I hope this video is helpful to you for your OSCE preparation. I wish you all the very best. Thank you for watching, and please don't forget to like and subscribe if you haven't done it already. Bye.